starting it now. It does take a little while to buffer. All right, we're good.
We're good, thank you. Good morning, San Ramon. It's Friday morning for our mayor's breakfast. I'm really pleased that our special guest speaker is Dr. Chris Fiorentano. He is the county chief health officer. And as we do every Friday morning, we'll always have our city manager, Joe Gorton, and Mr. Gorton will give an update on what's going on. We're also pleased, as we have every week so far, Candace Anderson, our county supervisor, District Number 2, and she will give an update. The bulk of our time really will have this opportunity for the doctor to talk about the medical directives, the underlying reasons why we are doing what we're doing in Contra Costa County, and we're leaving plenty of time. Stephen Spadowski, who is our deputy city manager, has gotten more than a few questions, excess, I think, of over 50 already. And we'll have most of the time that's remaining then residents asking questions. And if you want to ask a question, send it to info@sanramon.ca.gov. Steve will be getting those newer questions. We'll get a chance to ask those. So again, thank you for participating. And for those who watch it after the fact, we do have this on our COVID page, all of our prior mayor breakfasts, and we have that so people can listen. For those who might have interest, we did a mini one yesterday with Safeway to talk about the food chain supply and got good information about what's going on with Safeway and our local food chains. So with that introduction, Joe Gorton, our city manager, what's going on both this week and looking at perhaps follow-on weeks?
Thank you, Mr. Mayor. Good morning, everyone. I also will be very brief. I would like to invite any member of the community to go to our website, which Stephen will give a quick demonstration of in a minute. I would also like to put a shout out to C's Candy, who dropped off hundreds of pounds of candy to our first responders and our police officers in the city just last week. They, in conjunction with the 100 Club, have been distributing candy throughout the region to fire departments and veterans halls and hospitals. And so a really big thank you to them. It lifts everybody's spirits with that type of community commitment. We continue to be fully operational at the city, and we are making processes and putting things in place for the eventual return of our employees. So with that said, I again don't want to use too much time. I would like to give it over to Stephen for a quick demonstration of our website, where you can find a plethora of information.
Great, thank you. So as we do every week, we go over the COVID website. You can get to it at San Ramon's, the front page for the city. There's a link on there that says COVID-19, and it takes you to this page where we are putting all the information that we come across regarding COVID. We have tabs here for different areas, including local takeout that we've highlighted in the past that shows all the restaurants and how you can order from them. Links to the farmers market, to the county health website. And this week we also added a food resources tab, which if you are in need of either senior meals or any kind of meal assistance, we have links to our San Ramon Senior Center, Meals on Wheels, the food bank for Contra Costa County, and also community organizations who are either providing food or taking donations as well. Any questions that you have related to COVID, you can email info@sanramon.ca.gov, and we will get back to your questions as soon as we receive them. And that's it.
Thank you, Steve. I'd like to introduce Candace Anderson, our county supervisor, District Number 2, for her weekly update.
Well, great. Well, and once again, I always like to start by thanking all of you in the community for your continual support of our health officer orders that really are making a difference, that really have helped us flatten the curve. Love to direct you to also our county website, which I know there's a link on the city website, but it's just coronavirus.cchealth.org. Every day around 11:30 a.m. we are updating that. Now, since last week, last Friday, we were just under 1,000 cases in the county. We're at 999 cases. In the intervening 7 days, we've increased another 90 cases. We're up to 1,089 cases. We're averaging right now about 12 new cases a day. It's been 12 to 15 new cases a day. So the spread of the disease is still within the community. And now we are also tracking on our dashboard recovered cases. And right now we have 919 cases recovered. So we still have a little over 135 active cases in the community. In San Ramon, you had 2 new cases this last week. So you're up to 36 cases. So coronavirus, COVID-19 is active in your community as well. So what's new this week? We have some updated health orders that Chris might want to elaborate a little on, Dr. Farnatino. I'm doing it now. Contagious times extended right now is, we're saying it's from 7, it used to be from 7 days, now it's 7 to 10 days. Infectious periods where we used to have it a little shorter, now it's 48 hours, we think, before a test or before someone was symptomatic. And close contact really is now defined for tracking purposes. You're within 6 feet of someone for at least 15 minutes, which would then potentially expose you. And so today we've got kind of a fun health order coming out that again will give will give a little bit of elaboration on, where we're going to start allowing gatherings of up to 200 vehicles for graduation celebrations, for perhaps a worship service. You have to stay in your cars. If your windows are rolled down, you need to be wearing masks. You have to have a written plan in order to do this, and security to make sure that people aren't leaving their cars. But that's an order that's going to be taking effect on Tuesday. And we'll also be talking about the indicators, because a lot of jurisdictions are jumping into the governor's early phase 2 of opening up more businesses for curbside pickup delivery. Our health officer has really wanted to have at least a full 2 weeks to see the impact of the most recent health officer orders that opened up all construction, opened up all outside businesses, opened up more childcare camps, schools. We want to see the full 2 weeks of that before making changes. So Monday, there will be an evaluation about whether we're ready in our county to move on to phase 2. Still encouraging everyone to get tested. And we know that our call lines have been impacted. There have been a lot of improvements to it. And we still want to double the testing that we're doing, triple in some cases, because we need that to really help us have a better look at our indicators. You can also go online to make appointments at the 3 state sites that we also have within our county, but start with your own provider. We're encouraging providers to do that as well. And so, because I don't want to take up any more time, I'm excited to turn it over to Dr. Chris Farnatino, who is our amazing health officer, who we have tremendous faith and confidence in. He's been with the county for many, many years and in this role for the last 2 years.
Thank you, Candace. And I want to compliment, if I may, the fact that I've obviously, through Candace, has had a variety of questions about the health orders. I've raised questions about the impact from unemployment and business failures, and there are a variety of things I think that should also be variables. And I reached out to Dr. Farnatino, and he readily agreed to talk to me last Friday evening, in the evening, by the way, and you spent nearly half an hour on the phone with me, and I thought you were very gracious and you listened to all my concerns, and I want to thank you publicly for that. I followed up with a note sort of sharing with you what my concerns were, and you agreed to come on and talk to our residents about the thought process and reasons why the orders are in place, and to take questions from residents. So I want to say up front how much I appreciate that, and that I'm looking forward to, and other residents looking forward to the opportunity to hear your thoughts and also responses to their questions. So Dr. Farnatino, thank you for joining us, and please, it's all yours.
Thank you, Mayor. Thank you, Supervisor. Thank you, City Manager. Just want to kind of recap, how far we have come. So, this virus that we believe started in in China in December and January, and quickly we now know, looking back on this, that it spread, quickly to Europe, and then spread to the United States, including California. And we think there were multiple paths from travelers from both China and Europe that brought different cases of the virus into California. But we didn't know that at the time because there was such limited testing. The tests had to be approved by the CDC. They had to be sent to the CDC in Atlanta. There was very limits on the number of testing back in January and February. So we really were flying blind. By middle of March, we knew that the disease was spreading within our communities, but we didn't know how much. We didn't know. We couldn't measure it. We couldn't detect it, but we knew it was there because we were seeing cases of people who hadn't traveled anywhere and they had no connection to previous cases. So we knew it was widespread in the community, and the subsequent testing really confirmed that. So in the middle of March, we had instituted our first stay-at-home order, throughout the Bay Area. The state followed that shortly thereafter. Other states followed it as well, but the Bay Area was really one of the first places in the country to institute this. And because of our early action, the predictions we had at the time that there would have been, by this time that we're talking now, thousands, if not tens of thousands of deaths across the Bay Area from this virus, similar to what we have since then seen in places like New York and New Orleans and Chicago. Those predictions did not materialize because of the success of the stay-at-home orders and the cooperation of the communities to really follow them and stay at home and only keep very essential businesses open. What it has done is it's flattened the curve. It's bought us time, and that time has been really crucial. It's bought us time to get our hospitals prepared, to get extra ventilators for a future surge. It's got us time to get more personal protective equipment, although we're still in a shortage situation. Our emergency operations centers are still getting requests from hospitals and doctors' offices and dentists' offices saying they can't get those N95 masks, they can't get surgical gowns, they can't get face shields. They're coming to our county emergency operations center. We're getting some supplies from the state. It's not enough to fill everybody's request. So there's still those normal pipelines of commercial vendors producing these things are still not able to keep up. But we are better than the reports we heard from places like New York in March, where there were nurses and doctors wearing trash bags and wearing swim goggles to protect themselves because they didn't have enough personal medical equipment. So things are getting better, but we're not out of the woods on our personal protective equipment shortages yet. We're also doing a lot more testing, which is really helping us detect where the virus is passing in our community, but we're still not doing enough testing because most cases we find we still can't connect them to a previous case. So we know that there are cases out there that we are not detecting. We have a goal of testing at least 2 tests for every 1,000 individuals in our county. That's about 2,200 tests a day throughout the county. We're testing about 400 tests a day. I think our best day we've gone up to about 800 tests a day. So we still need to increase that, and we need to target that testing where it's going to be most useful. The groups that are being most likely to contract this virus, which includes folks who are working in those essential industries, especially the public-facing ones. So that's not only our healthcare workers and our first responders, but it's also the checkout clerk at Safeway and folks working in retail are coming into contact with the public. It's most especially the folks who work with our elder care facilities. We know that this virus is extremely deadly in our most elderly. And we've seen over half the deaths in our county have been in people who have lived who are living in nursing homes or other assisted living facilities for the elderly. And we know that those residents have been staying in place there, so they're not picking it up from the community, but those workers who go there, they have to go shopping, they have to go in and out to the community. And so we need to test those workers so we can pick it up early. We've bought time to learn more about this virus. We now know that there's a lot of the transmission of this virus is from people who don't show any symptoms or haven't shown any symptoms yet. In fact, the most contagious time period we now know for people when they're most likely to spread this virus is in the 24 hours before their symptoms start. So testing people without symptoms is really, really important, which is why we opened up our testing centers last week to anyone who wants to test, whether they have symptoms or not. But we're continuing to add more testing centers and ramp up more testing centers. So the testing is going to be key because we can't keep the stay-at-home lockdown in place forever. We need to start gradually opening up our community. But as we do that, there's going to be more spread, and we need to catch that spread early so we can interrupt those chains of spread and get the people who test positive and the ones who are in close contact to do a targeted shelter in place, essentially quarantine or isolation, so we can break those chains of spread. And that's going to be really critical, and that's why we're ramping up our case contact staff. We started with 16 before this started. We're up to over 75 individuals. We actually need to get to about 200 or 300 of those, and we're hiring people. We're using existing county workers. We're training librarians to do this work and other county workers who aren't even part of the health department. We're now recruiting volunteers as well as workers outside of the health department to do this critical work. We're really in the second inning of a 9-inning baseball game. We know all the predictions show there's going to be more surges. Depending on what we do will determine, and what the community does and how the community responds will determine how big those surges are and how well we're able to respond to them. But if we can, do widespread testing and we can identify those positive tests and their close contacts, that can go a long way to allowing us to safely, gradually open up our society. It is also buying us time for more treatments. So there's finally one drug, that's approved for this. We're still learning how well it works, but it seems to be at least partially effective in shortening the time course. It may help reduce the death rate of this virus. We're still trying to learn that, but it's an incredibly short supply. The company that's making it is ramping up production, but it's going to take months before they get to where there's enough drug for everyone who needs it. The company right now is giving their entire US supply to the federal government, who is then distributing it to states, and then the states are distributing it to counties based on the number of cases they've had in the local hospitals in the last few weeks. So based on that allotment, we, as our county, received our first shipment of this drug. We got one treatment course, enough to treat one individual. And as you know, by looking at our dashboard, we have 15 to 20 individuals in hospitals throughout our county on any given day. So most of those folks are not going to be able to get this drug. So we are just going to be distributing this drug. We've already distributed that first treatment course to John Muir because they've had the most cases, and we're going to be distributing it proportionally to all the hospitals as we get them. But we are getting shipments once every 2 weeks. So in 2 weeks, we might get one dose treatment course. We might get 2 treatment courses. We may not get any. And so we know for a while there's going to be most people with this disease are not going to be able to get this medication until the production ramps up. So the longer we can delay any future surges and the longer we can keep the case down, we're buying time for people so that if I get sick or you get sick, I don't want to get sick next week. I want to get sick in 2 months or 3 months so that there's a treatment that I can receive, and my chances of not having to go on a ventilator, not dying, will be improved from where it is right now. And so, you know, it's all about buying time, getting better prepared, learning more about this virus. At first, when this virus came, we didn't think cloth masks were that helpful if you didn't have symptoms. We now learn, because we know that so much transmission occurs without symptoms, and the studies are now showing that if everyone covers their face, it prevents virus particles from spreading as much, and it cuts down the risk. So my mask protects you and your mask protects me. So that's why we're urging everyone to use a face covering when you're out close to anybody who's not in your household. All these things make a difference and allow us to more safely, step by step, open up our economy and open up our society without leading to a tremendous surge of cases that overwhelms our hospitals and leads to more deaths. So I think I'll stop there and see if we have, you know, questions we want to address.
Great, thank you. Steve, I know you've organized some questions. I wasn't sure if you're prepared right now to start some questions.
Yep, very much so, Mayor. Also, I wanted to note that a lot of the questions do overlap. So if your specific question isn't asked, I'm trying to condense them into topics in order to save time. So, and if we do not get to your question, we will respond in some way, shape, or form within the next few days. But the first question is, could you please explain the decision-making process? Is it just medical professionals making the decisions? If others are involved, who are they?
So the decisions around the health orders, we really take input from lots of different perspectives. We are in contact with the Board of Supervisors. We talk several times a week. We have our Emergency Operations Center that is not only the health department, but it's all branches of the county government that's there. There's fire and law, and public works and others that are part of our Emergency Operations Center. We are we get input from the community, we get letters, we get emails, but we're getting a lot of input in different ways. Supervisor Anderson now chairs a ad hoc committee, which has been meeting the last couple of weeks, that to receive input about these health orders and how we can safely open up different sectors of the economy. So those have been very popular and very well attended. We had our last one yesterday. So we're trying to get, you know, input and feedback from all aspects of the community, because this is a once in 100-year challenge. We haven't seen a pandemic with this type of lethality since 1918, and some estimates say this COVID-19 is even more deadly than the 1918 flu pandemic, and it's a worldwide challenge. You know, there's a national state of emergency, there's a state emergency declaration, there's a county emergency declaration, and it's really a global emergency that's really unprecedented in modern times. And so we know it's both the virus and our strategies to try to contain it and prevent the spread have impacts to everyone in the community. So we're really trying to seek that input.
I appreciate that response. To give you some context, my great-grandfather passed away in the second wave back in Utah in 1919. So our family is familiar with the impact, and there were some 700-odd thousand people died. Proportionally, that would be well over 2 million people today dying of this. So I'm not unfamiliar, but I think back to that question, a lot of us are concerned that you need specifically to have business people, you need to have community leaders, you need to have city managers, you need to have people involved in mental health, and perhaps even people involved in this food supply chain, intimately involved in being on a panel to give you feedback, because each of those areas are suffering tremendous hits. Is there a mechanism of people that you can perhaps broaden out, if it doesn't exist now, to be able to get broader feedback on these other areas?
I'm definitely open to thinking about new ways to receive feedback. You know, the ad hoc committee just started up 2 weeks ago, and I know the supervisors who are on that committee are working on different formats to try to get different feedback from the community, but I'm definitely open to other kind of venues as well.
Steve?
Great. The next question is, could the health officer give weekly updates to the public, letting us know what's being considered?
Again, there's different ways to get feedback. You know, that ad hoc committee I'm now attending on a regular basis, meeting on a weekly basis. So that's one forum. I'm talking with the media almost a daily basis. So that's another way we're trying to get our messages out. We're really trying to keep our health department website, cchealth.org/coronavirus, really up to date with all the new changes, all the new things that are coming up. So we're really trying to, we have a whole team of communicators in our, what we call our joint information center, to try to work on really getting the message out. So we're really trying to do our best to kind of communicate. This is a really rapidly evolving event. Things are changing so quickly, and I know it's challenging to keep up on all the changes, but we're really trying to make sure we have that information out there for people as quickly as we can get it out there.
And can I just add, I think it's really important, sort of reiterating what Chris said about the website. The county's website is updated daily, and we do have almost every day a new press release coming out with updated information. And then that's really where the most up-to-date information is. And the ad hoc committee meeting, it meets at 1:30 every Thursday now, and it's via Zoom, and it's on the county website as well. We take 1 or 2 topics each week, and so this upcoming week we're going to be talking both about recreation. We're sort of finishing up a conversation from last week, and also the impact on sort of what we're calling, you know, the drive up retail that will likely be opened up as part of this phase 2. And what we're finding is individuals who are engaged in that business call in, they get questions answered. We get things that we can clarify on our FAQs. That's the other place I really encourage people to go. Daily on the county's website, these FAQs are updated about what does the health order mean. And then you can track the indicators. You know, Chris mentioned these indicators that they are following to make these determinations. There's regularly updated information about how we're doing in each of those 5 categories.
Great. The next question, I'm taking several questions and putting them together, but they're all related to, you know, why is Contra Costa not moving forward into phase 2 with much of the state, including San Francisco, San Mateo, and Marin counties, and also questions related to, you know, will all 5 counties still coordinate? It looks like that is now breaking up with different rules between different counties.
Yeah, so when the governor really announced a few weeks ago their plan to move and slowly open up the stay-at-home orders, he outlined a series of phases and made very clear that there's really 3 groups of counties that he has in mind. One is the bulk of counties that are going to be following at the same pace as the state order in moving from phase 1 to early phase 2, later phase 2, and into phase 3. There's a group of extremely rural counties that have very few cases. They have very low population density, which means there's lower risk for spread of the virus. And they have enough testing going on that they could pick up a surge if it happened. And those counties can apply for a variance to the state to open up faster than the state is going. And then there's a third group of counties, which mostly represent more urban counties that have higher case counts and higher population densities that are much higher risk for a surge of cases. that are going to move slower than the state, that need to open up at a little more slower pace. And the local orders will be more restrictive than the state and will be opening up at a slower pace. So those urban counties include the Bay Area, the LA and the surrounding counties. And the Bay Area is really one big ecosystem. We know the first cases in California started in the Bay Area, and we had the highest number of cases in the state before we put in our stay-at-home orders. And we know there's so much travel between business and recreation and shopping among all the Bay Area counties. We're tied together by the BART system, that what one county does affects the other. And so that's why we have been the 6 counties plus the city of Berkeley, which has its own health department. We've been working together in coordination on these health orders, and because we know what one county does affects the other. We also do know that there are some differences. I mean, San Francisco, for example, it's the second densest population density of any city in the United States after New York City. So they have unique risks. They have a large homeless population. They have really unique risks that they need to attend to. The entire population of San Francisco is similar to the population of Contra Costa County, yet the square footage of San Francisco is about the square footage of the city of Concord. So they are, having some additional changes to their orders that are going to be a little bit more restrictive than some of the other counties. We together 2 weeks ago put out a paper describing what are the indicators that we're going to be following in making these decisions about when it is safe to open up our communities. And that's those 5 indicators include that the number of cases is on a downward trend, that the number of hospital cases is stable or decreasing, and that there's at least 50% of the hospital capacity, both in the regular hospital and their ICU beds, that they can take care of other things besides COVID, because hospitals still need to take care of heart attacks and strokes and treat cancer and do hip replacement surgeries and all those other things that hospitals do. So they can't have 100% of their hospital taken up with dealing with COVID. That we have enough testing. Again, we need to get to 22,000 tests per day, and we're that's 3 or 4 times where we are now. That we have enough of these contact tracers that we can detect 90%, we can contact 90% or more of cases, 90% more of their contacts, and that we can ensure that they have a safe place to isolate or quarantine, and that we have enough PPE that we don't have to tell our healthcare workers and our first responders that we're in a surge and we don't have a mask for you to protect yourself. So we're making progress on all those indicators. We're meeting the first 2 indicators on cases and hospitalizations, but we still aren't there with the other 3 indicators. So that's why we're moving a little slower than the state. So the state last Friday went to early phase 2 to allow drive-up curbside retail and associated manufacturing that goes along with that. Most of the Bay Area health officers have said, we really want to see 2 weeks of good data since we made our last big change. So it was just a week ago Monday. So that was 11 days ago that we opened up our counties to all construction, all outdoor businesses, and a lot of outdoor recreation. And it takes a couple of weeks to see the effect of that, because we know that if there's more interactions with people and more spread, it takes 1 to 2 weeks for people to develop symptoms. It can take another week before people get sick enough to show up in the hospital. So our case numbers or hospital numbers might be lagging a couple weeks. So the most of the improvement we're continuing to see in the last week or two really is a result of the stricter stay-at-home order before May 4th, and we've yet to see the effects. And we know for everyone who's out there driving around, you see the traffic is starting to pick up. People are out and about more, and so it, we're concerned that could lead to more cases. So on Monday, and I think different counties have communicated this a little bit differently, but really what they're saying is on Monday, it'll be 2 weeks after that May 4th date. And if our numbers are continuing to look good and we're continuing to head in the right direction by Monday, most of these counties are prepared to issue a new order that would take a place within a few days of that Monday. We're probably going to be targeting Tuesday for an order to go into effect, where we would open up that curbside retail. There's going to be rules around it that will match what the state has set up. So the state has a really good website. It's coronavirus.ca.gov, and it's got their road to recovery on there, and it's got sector by sector guidance for manufacturing, warehousing, retail, on the steps they need to do to make their operations safe for their employees and their customers. And they've got a checklist that they'll have to fill out. And so for businesses that want to get prepared for that, I encourage them to go to that website, look at that checklist, see how you can get your business prepared to be open when you get the green light.
Doctor, one of the frustrations that a lot of residents have is that several months ago, we were asked to flatten the curve. And so the game plan was that we wanted to flatten the curve so the hospitals could manage the number of patients that came through. And your first two indicators are really the classic signs: the number of folks who were hospitalized because of COVID and the number of ICU beds that are taken up by COVID, both of which were well below the threshold. And so there's a lot of feeling among residents that the goalposts got moved on us, that you told us to do one thing, we accomplished it, and then you move the goalposts again on us, and we're not opening things up. And the reason I shared this, and I'm being a little repetitious, is that we have huge amounts of unemployment. We have people whose businesses can't survive 1 or 2 days, let alone 1 or 2 more weeks of being closed down. The impact on mental health throughout our entire community is devastating. We're seeing that in our own city between domestic violence. We see it with 5150s, which are people who are being hospitalized, many of them which are adolescents in our community. We're seeing a spike in that. So there are other huge costs associated with this prolonged lockdown. And when we've played our part, we flattened the curve. We know that the hospitalizations and ICUs are substantially lower than what we need, and we're not being opened up enough. And so there's a lot of anger and frustration out there. I know you know it. I know Candace hears it, but I wanted you to make sure and our residents know that that's being expressed to you and that we think those variables should play a larger role. So enough said. Steve.
Actually, Mayor, that was the next question. It did relate to, and this was a pretty well-worded question. And unfortunately, the debate is being framed as those who want to kill people to make money versus those who want to protect citizens from the virus, even if it causes the Great Depression. So that's part of your statement there, Mayor, is what other considerations are being made with these decisions in terms of mental health and the businesses.
Right, because we are seeing a substantial number of people. But I'll take an example. One of my frustrations is that, and this is not on you, doctor, at all, that the state said that non-emergency medical things should not continue. And you have 2 months, maybe 2.5 months, as an example of mammograms not being done. And in Contra Costa County alone, 2 women per day are diagnosed with cancer from mammograms. We have 60 to 70 days, 140 women who will go undiagnosed in that one area alone. These are the hidden costs that are devastating. Cancer screening for skin cancer, those who are missing their other routine cancer screenings. These are the kinds of costs that we've got to clearly say to our hospitals and to our leaders, we've got to open that up. We've got to allow these non-emergency stuff to continue because people are going to be dying from this, not today, but in the future.
You know, it's a really good point, and there was a lot of discouragement of people to get routine healthcare initially as the hospitals were scrambling to prepare, and there was a lot of fear of people going to hospitals, fearing that they'd go to a hospital, sit in a waiting room, and get this virus in the waiting room. So a lot of people put off things, and we saw that, you know, our emergency room traffic dropped 50% right away. And we never told anyone they couldn't go to an emergency room, but people were scared. People were afraid to go. Now the hospitals and the clinics are better prepared. They've got spacing. They're screening visitors, checking their temperatures, checking them for symptoms. Anybody with any kind of fever or respiratory symptoms immediately gets sent to a tent where they can get screened and get tested. So the hospitals have been prepared to resume routine care, and now we're encouraging people to resume care. And I'm seeing that every day. I'm getting inquiries from medical clinics. Is it okay to start my business? Dental offices, I want to get started. Is it okay? And we're saying, yes, go okay. The state has guidelines on how to do it safely. As long as you're following those guidelines, as long as you have the proper PPE, please go ahead. We're really encouraging people to get back to your routine care, whether it's your blood pressure or your diabetes or your cancer screening or your kids getting their checkups and their vaccines. We don't want to put those things off. So that's another thing that is ramping up. The main limit right now is on the PPE, where there's still those shortages of PPE. But as we're getting the PPE, we're getting more and more of those healthcare and dental care and eye care and things ramping up and getting back up to speed.
Thank you, sir.
All right, there's a series of questions related to testing, and it's really broken down into three categories. So I'll start with the first one. Well, two of them are related. What are the county's plans for ramping up the testing for both antibodies and the COVID-19 testing?
Yeah, so let me first talk about the most of the testing we're doing now, which is a direct test for the virus. And so it can pick up people with symptoms as well as people before they get symptoms. And we now know some people never get symptoms, but still have the virus and can pass it on. And that's the most important test right now. And we now have 9 test centers across the county, 6 directly run by the county and 3 run by the state. We had one at Heather Farms in Walnut Creek, and we're actually moving that to Tice Valley. There's also one at Bishop Ranch. These can be, we have an appointment line where people can call and get an appointment. We also, the state-run ones, you can actually schedule an appointment online, and the link to the online scheduling is also on our website. So you can go to our website to get those and sign up. I myself just went yesterday, and I went to the online, and it took me 5 minutes to register, and I had an appointment available today, but I don't have any symptoms, and I didn't have time today, so I scheduled one when it was convenient for me, which is this coming Wednesday. But there are appointments available same day or next day for these testing sites. We initially, when we first opened these up, we had a real surge of calls. So there were some complaints. People were on the phone a long time. We've now updated it so that you get a call back, so you can leave your number and somebody will call you back, so you don't have to be stuck on hold. And again, we have this online option too, where you book it online without having to get on the phone. So that's 9 testing sites that the county is running, but also a lot of the healthcare providers are now offering these tests. So John Muir has tests, Kaiser is running tests, La Clinica, health centers are running tests, lifelong medical clinics are running tests, and some private doctors' offices are also doing these tests. And we're really, and we're relying on our community partners to really reach our goal to get this testing. Already, the county's only doing a minority of all the tests. So Kaiser, John Muir, these other private community partners are doing the bulk of the tests already, and that's going to continue. And we want to really, besides anyone who wants a test to get a test, we really want to focus on testing those high-risk groups. The state is now requiring, as of this week, that nursing homes test all their staff and residents on a regular basis, and they have to have a plan in place within the next couple of weeks on how they're going to do that, at least monthly. We are encouraging other facilities like residential care homes for the elderly to also do regular testing of their staff and residents on an at least monthly basis. We're encouraging, first responders and healthcare workers who are in high contact types of work, as well as folks who work in retail who are concerned because they are out and in contact with a lot of the public. We're encouraging them to get tested regularly, whether or not you have symptoms. And if we can really ramp up this testing, that will allow us to identify cases, reduce the spread, keep the numbers down, and then we can more quickly and rapidly open up our economy.
And then as a follow-up question, what about the availability and any plans for antibody testing?
Yes, thank you. Forgot the second part of the question is about antibody testing. So antibody testing, there's about 100 different companies who make antibody tests, but only about 10 or so are actually FDA approved. The others, there's lots of concerns about the quality of the test. Some of them aren't any better than flipping a coin. Even among the 10 or so that are FDA approved, some of them have low quality. For example, there's a test that is 90% accurate. Well, and that sounds pretty good. So that 90% of the time, if you have antibodies, it will detect them. But and 90% of the time when it says you have antibodies, you really do. But the problem with that is right now, we think most of the community doesn't have antibodies. Maybe 2 or 3 or 4% of the community has been exposed at most. And so if you're applying this test sort of randomly in the community and you get a positive test, it's actually very likely that positive test is a false positive when you're testing a community where there's not that many people who actually do have the antibodies. So even a 90% test, you're actually a positive test is really no better than flipping a coin as to tell you whether you really do have antibodies or not. So we need to get the test to get up to that 99.9% type of level of accuracy to really have more confidence in them. And then we're not sure what the antibody results mean. So we're hoping that if you have antibodies, it means that you're immune to the virus and you can't get it again, but we don't know that yet. And we also don't know if you do have immunity, how long is that going to last? We know that some viruses, like measles, you get it once and you're immune for life. We know other things like the flu, you're immune for a few months and then you can get it year after year after year after year. So we don't know if you have immunity, how long it's going to last. So we're not at the point where having a result of that test can lead to any recommendations on actions. Can we tell a healthcare worker, oh, you don't have to worry about being infected, about bringing this virus home to your family because you're immune? We can't say that yet. We can't say, oh, you're better off going into a high-risk area than somebody else because you have antibodies. We don't know how to say that yet. So the best use right now, and actually we're involved in a study working with some of the research universities in the Bay Area on doing some community level testing. So testing a group of individuals randomly across the community to understand how common the antibodies are, to give us an idea of how much the virus is spreading in our community. So that kind of study where we're looking at groups of people and making learning more about the virus is very helpful, but it's not quite yet ready for prime time as far as an individual test to really give you any kind of information you can actually take action on.
Great. And as a yet another follow-up, how often should I get tested, and should I get tested if I have no symptoms?
Yeah, so you definitely encourage people to get tested if you have no symptoms. We're actually recommending, at least monthly for anyone who is concerned or anyone who is out in the community in contact with others. We're really not trying to put any limits on who can get tested, but we're especially encouraging those folks who have higher exposures to get tested on at least a monthly basis.
Can I follow up a little bit on that question, in that if you look at those who've actually succumbed to the disease in Contra Costa County, nobody under 50 has passed away. And I think one of the messages that would be important, this is still a very serious illness, so I'm not dismissing that. And I think in the US, 1,000 people under the age of 50 have passed away from COVID. But 3.5 times the same number under 50 have passed away from influenza. They're both very dangerous diseases. But I think it's important that we not scare people, especially those with children. So there's unrealistic fears, again, to the mental health piece. I think it'd be important if you could communicate to the residents that their children are much more likely to be at risk of many other diseases and not COVID, to help alleviate a lot of the terror and the fear that's out there. Or am I off base, sir?
Well, it's definitely true that age is one of the biggest risk factors for dying from this virus. And in this county, everyone who's died has been age 50 or older. As a person myself who's over age 50, that's concerning to me. But we know in the rest of the country, the rest of the state, the rest of the world, young people do die. They just don't die at quite as high a rate. And there's been tragic stories of people in their 20s and even children dying. They've been extremely rare, fortunately, but we're learning more about this virus as it goes on. We're now learning about these inflammatory conditions similar to a disease called Kawasaki's disease that affects children, and they get blood clots and they get heart damage. We've learned about these strange rashes kids are getting where their toes and fingers turn purple. So we're learning more about this, but clearly the biggest risk is age and being older and having chronic illnesses like heart disease and lung disease. Most young people do well, but most young people also are at risk for spreading the disease to our elders. And so the way we protect our elders is to reduce the spread within the community, so that nursing home worker doesn't pick it up at the grocery store and then bring it in to the nursing home.
All right, and as a reminder, you can please submit your questions to info@sanramon.ca.gov. We do have a lot of questions left, so I'm trying to condense them into areas of similar questions, and we will get back to you. And some of the questions that we're receiving have been answered on prior Mayor's Breakfast broadcasts, and we'll get you those links and let you know where those answers are and for some of those questions. Regarding contact tracing, we received a question as to how many people were originally doing contact tracing in the county. How many more do you need? Are you accepting volunteers for contact tracing?
Yes, so contact tracing is something that public health departments have always traditionally done. We do it for, we've had a few measles outbreaks in the last few years. We do it for, cases of tuberculosis, cases of meningitis. But usually we're dealing with 1 or 2 or a handful of cases. And so we've had a staff of 16 doing this over the years. And now we've had to ramp that up. We've already ramped it up to over 75 individuals. We pulled in staff from other departments outside the health department, including librarians, to train them to do this. We now are partnering with UCSF. They've got an online training program to do high quality training for new staff as we're bringing them on. We just got approved by the state to be the second county in the state to pilot their new contact tracing software that'll help us use technology to do this more efficiently. But we think we still need to get to about 200 or 300 of these contact tracers to really be able to handle any upcoming surges and all the the predictions are showing as we open up the economy, we're probably going to have surges, whether they come in the summer or they come in the fall, but they're expected to come. So we are accepting applications now for both people who want to be hired to be paid. We have some additional paid positions that got approved by the Board of Supervisors. Thank you, Supervisor Anderson. As well as we're also taking volunteers. And so there's a link on our website where you can submit a resume and sign up to be part of our contact tracing workforce.
All right. Next question is, wouldn't it be more effective to have people over the age of 70 and those at risk continue to shelter in place, and for the majority of the population to go back to regular life and achieve herd immunity? Since a vaccine is not guaranteed and no real timeline can be given, this would seem to be the most logical way of moving forward now that hospitals are not at risk of being overrun. And we also get questions related to that. Why can't we all just wear a mask and get back to normal life?
Good questions. As we open things up, because things will be allowed, it's still not going to be recommended for people who are at high risk. So just because you can go to the grocery store right now, I'm telling my in-laws who live in Cupertino, who are in their 80s, I don't want you going to the grocery store. So they're getting home delivery of their groceries. And so as we open things up more, it's still, going to be recommended that folks who are at high risk try to limit their exposure in the community. Masks and facial coverings help, but they're not going to be 100% guarantee against spreading the virus. If we opened up everything now, we would lead to a kind of a surge that we were seeing in New York City, even in New York City, despite the tremendous number of deaths, I was watching pictures on the news. You probably all saw this of trenches where they were piling coffins up 2 deep and 3 wide and 10 long in these big trenches because they could not keep up with the number of bodies. Even despite the tremendous tragedy that's happened in New York City, most people in New York City still haven't achieved herd immunity. And so that they're still not opening up their society. And most of the estimates say it would take a year or longer for enough of the virus to spread to lead to herd immunity, and the casualties that would result in the meantime would be an incredible number of deaths. And so a strategy of just trying to open things up to get quickly herd immunity is not something that I can endorse, because the death toll and the loss of life would just be too great. So again, we want to buy time, because last month we didn't have a drug that could treat this. Now we have a drug, and we're still hoping that that's going to reduce the death toll when people do get sick. Maybe next month we'll have another drug that works even better. But even the drug we have now, most people can't get it. But maybe next month more people can get it. So the more time we buy, the longer we can keep the virus suppressed, the better we'll be able to respond. And maybe we'll have a vaccine. And we all think that's going to be maybe a long way away. But even before a vaccine, we're going to learn more about this virus. Even the doctors, a good friend of mine works in the ICU, and they're learning so much more about how to treat this virus. They rotate people on the ventilator onto their stomachs, and that seems to help the lungs breathe better. They're giving them blood thinners because they're seeing a lot of complications with blood clots. So they're learning day by day how to better treat this virus and help save lives. So even short of getting to a vaccine, the more time we can buy so the doctors can learn how to better treat these severe cases and have more tools to treat these severe cases, the better off we're going to be, and the lower the death rate's going to be.
Steve, if I could follow up a little bit, I think there's a and Steve mentioned this, there seems to be this ongoing two camps, those who want to open up the economy and kill lots of people, and on the other side want to lock it down regardless of the economic costs. And I think that's a very simplistic way to look at this. One of the frustrations is that even the best scientists out there say that a vaccination is 18 months away if we get lucky, and there's never been a coronavirus ever developed.
Mhm.
If that is one of our premises, then we're eventually all going to catch the coronavirus. And it means that those who are older at risk are going to probably have to remain isolated for the definite future. But the question that most of us pose is, and the frustration with LA County in particular, is how long do you think the economy can sustain itself with this sort of lockdown when you have, and I know from us that as a city, we're doing okay financially and that we have ample reserves to ride this out for a little while, but there's an utter collapse of the state revenues. Our school districts are collapsing in terms of their ability to fund issues. I mean, how long can society as we understand it survive with this sort of unlimited lockdown in place until this holy grail of a vaccination comes along, which may not ever happen? I mean, how long does this have to go on? We can't go on much longer and maintain our level of civilization.
Yeah, I think you made a great point. It's really not a black and white type of
No.
argument. So we're really trying to steer a middle path. So the Bay Area's stay-at-home orders were put in before the state. They were stricter than the state. We're starting to gradually, step by step, loosen things up, and we're going to continue to do that. So we opened up construction and outdoor businesses 11 days ago. Today, we're opening up vehicle-based gatherings. So as of today, and that'll go into effect on Tuesday, we're really going to be caught back up to where the state was in phase 1. Last Friday, the state moved to early phase 2. If our numbers continue to look good next week, we'll move into early phase 2 next week. And then every few weeks, as long as we're heading in the right direction, we'll continue to step by step open things up on a slow, measured pace driven by the data. So it's not a choice between staying locked down and opening everything up all at once. We're trying to chart that kind of careful, measured course.
Right, and related to that, we received a lot of questions about when will a particular activity open up, such as, when will hotels and other venues be able to host meetings? Do you think that will happen in 2020? And also, a lot of questions about when do you anticipate sports activities for kids and pools reopening? If you can give any kind of timeline at this point.
Yeah, and I think that the most useful thing is to look at that state website, because they break those different activities into the different stages. And so except for those extremely rural counties that are going to get approved to go faster, no county can go faster than the state. So a lot of those activities you mentioned, like public pools and meetings, are really in the phase 3 of the state plan. So the state, just this Tuesday, so 3 days ago, moved into full stage 2, and we don't know yet when they're going to be ready to move into phase 3. So that pacing will really depend a lot on the state, and the counties will follow after that based on the local data.
If I could, we talked about this last week, Doctor, is that it's at least my opinion that the state and the county should not pick and choose economic winners and losers. And they shouldn't pick which businesses get to open and which businesses get to fail, essentially. But I think we'd be better served if you would give us an objective criteria of activities that have to occur. Here's the guidelines of things that you have to do. And if a business can meet those guidelines, they can open. And if they can't meet the guidelines, they can't open. And no business person or organization will open their business if they can't meet the guidelines, because their insurance policies and liabilities will not cover them if they violate those rules. So you've got a mechanism in place to help enforce that. But it'd be much more helpful if you would give us objective criteria and to let businesses know what they've got to do to be able to open and survive.
Yeah, and I agree. That's a really good point, and I think we need to move past this sort of definition of essential versus non-essential businesses. And I think we are gradually moving away from that. And in the state's, criteria, they've really got sector by sector guidelines, and they're opening up sectors and not deciding which retail is essential and which is not, which manufacturing is essential, which is not. And they have, on that website, they have these criteria and they have checklists. And so I think businesses can look there and start getting prepared. And I think gradually it's going to get to the point when we're more deeply into phase 3, where most or all businesses are going to be open, allowed to open, as long as they can follow those criteria.
Yeah. Steve, given the time, can you pick up a really good question to bring it to a close? We've gone over, and he's been very, very respectful to do that. So thank you, sir.
Sure, no problem. One of the questions that we received is in regards to other countries and what they've done and what we've learned from them, such as Sweden did not lock down and they implemented social distancing measures. What have we learned, and what can we do to emulate that?
Yeah, so we really are trying to, look at lots of different countries and see their examples and see what's worked and what hasn't. Understanding that, not every model can always fit perfectly with the United States, but Sweden didn't lock down their society as much. They have put some rules in place, but they actually have seen a very high death toll in their senior population, and their death rates in their seniors are higher than most of the other Scandinavian countries around them. So in some ways, they were a model for how you can try to have some flexibility in the rules, but on the other hand, it was not as successful, and their death rates have been markedly higher than the surrounding countries. The Asian countries have had the most experience with this virus, and that's in large part where we learned about the community facial coverings. The study showed that the countries that made that either a mandatory or just became a cultural standard really seemed to have a slower spread of the virus than countries that didn't push facial coverings. There's been different approaches for contact tracing in different countries. Some countries have really moved people out of their homes if they live with other people, and have put them in apartments or other facilities so that they had a place to isolate and not spread it within the home. Some countries, really forced people to leave their homes. In this country, I don't think we'd ever be doing that because we value that freedom too much. But I think it was, the success of some of those metrics is helping us think that we need to really try to provide options for people who feel like they can't safely isolate in their homes. Maybe they have an elderly grandparent in the home that they don't want to expose. That we need to try to find ways to provide options for people to isolate at their homes. We've already done that with some of our most vulnerable population. We've closed down our 3 largest homeless shelters, which were large groups of people crowded together, a lot with chronic illnesses, and we've moved them into apartments. We've worked with our sheriff's department to decompress the jail, and so it's not as crowded. And so, there's been outbreaks in many big outbreaks in jails. There's many big outbreaks in homeless shelters in other counties in California and other parts of the country, and we've avoided those in this county so far because of doing that. And those are kind of things we've, learning from these other countries. So we're continuing to kind of learn kind of best practices from other countries, what's working and what's not working. And it's all, we're kind of all learning as we go. And unfortunately, the final exam isn't going to be months from now. So we can see some countries that had really early successes, like Taiwan and Singapore, And then they loosened up, and then they started getting another spike of cases. So we're kind of still learning, what's effective and how long it's effective, and how long those kind of measures need to be kept in place, and when you can safely start loosening them up. So it's all, again, it's a worldwide disaster that no one's ever faced before. So we're all kind of learning as we're going.
Dr. Fornato, I want to thank you very much for taking a better part of your morning to inform residents of what's going on. You are always welcome to come back, so please let me know. We do this every Friday to update the residents, and you're welcome to come back. As always, Candace Anderson, our county supervisor, I thank you for being a part of our weeks. Steve, you've done a great job taking lots and lots of questions and putting them all together for us, so I appreciate that. And as always, Joe Gorton, our steadfast city leader who keeps everything going well for us. Everybody have a safe weekend. Do all your important social distancing and keep others safe. Thank you very much.